At birth, I had some traumatic brain injury, and then didn't really notice any problems until I was like in 4th grade. My teacher noticed I had some learning difficulties. And then in 7th grade, they actually gave me an IQ test, which I scored genius level on, which kind of surprised them. After that, I started attending IUPUI for construction, and I ended up working at the school in what they called adaptive educational services. People with different mental disabilities and physical disabilities. I kind of identified with that group. Eventually I had some psychological problems, started seeing a therapist and a psychologist. Eventually I was just overwhelmed with the work environment, and I had to quit. And then there was a period of time I was just lost in the wind. Eventually, it's kind of lucky I got hit by a car, because they actually took me to the hospital. Then I got health insurance. So I started seeing doctors and psychologists then. It's been, I think, 15 years I've been with Eskenazi Health, both for medical and psychological. And I participate in the community council, the advisory board, and also enjoy attending different group sessions.
What has always been meaningful to me has been celebrating like small gains. So people have their long-term goals, and recovery can be a long process, but being sure to celebrate the day-to-day things that are important to them. So whether that is reconnecting with an estranged family member, or acquiring furniture for their apartment, or just not feeling as hopeless as they once did.
It's a safe environment to expose things that have happened in your past, and they just come out naturally. I would say 2 or 3 people in the group have had the same basic issue, and then you don't have to be so embarrassed about it that you're really in the same boat with a whole bunch of people. Doing in group, I started making decorations, starting with Christmas, and it just grew into something. I brought in vases and painted the vases. I don't usually sell my art because they're close, so I keep them, but I do display them. Stigma is a big problem, I think, that most people have, and that they're embarrassed to engage in psychological treatment. But I think it's something the community is working on. Little by little, I think the stigma of mental health care is going away. That everybody at some point in their time needs a little assistance pulling themselves back together. I don't believe my views on recovery have changed. Everyone should be entitled to dignity, opportunity, and well-being. We're all one community. Just improving yourself like 1% a day, it's a little bit each day, but by the end of a year, it's a great improvement.